This is our PSA on the common family experience when a son is diagnosed with Duchenne muscular dystrophy.
During the PSA, we discussed 3 different treatments. The first is steroid treatment, second is exon skipping treatment, and third is family therapy.
At the very end, we provide a resource guide with 3 nonprofit organizations that provide DMD families with assistance financially.
I understand that receiving the diagnosis of Duchenne muscular dystrophy for your son has been difficult for you. I assure you we're here to provide the best care possible. Can you give me a brief background of the diagnosis?
It's just so overwhelming, doctor. I want to do everything I can to help my son. One of the initial steps we did was measure the level of creatine kinase in his blood using a CK blood test. And then according to his physician, the elevated CK levels indicated muscle damage. And then we underwent genetic testing. We found a mutation in a dystrophin gene and determined that my son has DMD.
I know it can be tough. Duchenne muscular dystrophy is a progressive condition that weakens muscles over time. That being said, steroids like prednisone can slow down the progression, improve muscle strength, and delay the need for a wheelchair. It's a corticosteroid that acts as an anti-inflammatory agent, reducing the release of pro-inflammatory molecules and immune cells that contribute to that muscle inflammation and damage. By dampening that inflammation, prednisone helps to preserve the muscle fibers and improve overall muscle function.
But I've heard about the side effects. Aren't they risky?
Yes, there are potential side effects, but we carefully monitor each patient and adjust the dosage accordingly. Steroids can cause weight gain, mood swings, and even impact bone health. However, the benefits can outweigh the risks, especially in slowing down the progression of DMD. By starting your son on steroids early, we can potentially provide him with a better quality of life for a longer period of time.
If it can help my son, then I'd want to give it a try.
I appreciate your trust. We'll start with the initial dosage of 1 milligram per kilogram per day and closely monitor his progress. We'll work together to manage any side effects that may occur and make adjustments as needed. Remember, we're here for you every step of the way, so don't hesitate to reach out if you have any questions or concerns. It's so nice to see you both for Bob's weekly appointments to monitor his progression of DMD. I wanted to ask how the steroid treatment was going.
I think that the steroid treatment is okay. I feel that my muscles are starting to weaken a bit though because I'm having some trouble catching up to my friends when we are walking from class to class together. I'm in middle school now, so we have different class periods, which requires me to walk pretty long distances multiple times a day.
That must be frustrating. Have you been performing active stretching exercises of the upper and lower body every day, as well as doing low impact workouts such as swimming regularly? Have you also been wearing your braces during the day to assist with walking and everyday activities?
Yes, I have, but I'm starting to get worried about when my disease will progress and how soon it will be until I'm non-ambulatory. Do you have any other suggestions or treatments to prevent DMD from progressing any faster or to even push back the time when I will lose ambulation?
Well, actually, I do have a suggestion. There are currently 4 FDA-approved therapies for DMD that may drastically improve your quality of life with the disease. They're called exon skipping therapies. As I'm sure you know by now, DMD is caused by the mutations in the dystrophin gene, which makes a non-functional dystrophin protein. If there's a mutation in a specific exon which codes for the dystrophin protein, these treatments fix that mutation, allowing for mostly functional dystrophin to be made in your body. Your mom would need to take you to get another genetic test so that we know exactly which exon is mutated in your specific case of DMD. If your mutation matches with the therapies, I would highly recommend that you try it out.
Wow, this seems like a great option. What are the benefits if Bob were to use these exon skipping therapies?
These treatments are more beneficial than any other treatment currently being offered to patients with DMD. This is because these treatments increase dystrophin levels in patients more than any other type of treatment. This allows for boys to walk longer distances, slows down the deterioration of the respiratory function, and decreases the likelihood of losing ambulation. It addresses many of the concerns that you listed earlier, Bob.
I am really interested in this treatment, but what are the downsides?
Well, first of all, these therapies are really expensive and insurance companies are still debating whether or not to cover the price of the drug. So even with insurance, you still might be paying a high copay. Also, there are only 4 treatments that I can prescribe at this time. There's Exondys 51 if you have the mutation in exon 51, Amondys 45 for exon 45, and Viltepso or Vyondys 53 for exon 53 of the dystrophin gene. If you have the mutation in any other exon, that is not one of these three, these therapies would not work. The treatments also require weekly IV fusions, so time must be taken out of your week to allow for this, as well as the ability to endure needles. These types of treatments also pose a potential risk for kidney toxicity, so kidney health must be monitored regularly. However, severe kidney issues or kidney failure is very rare. You may have a bit more of a mild side effects such as headache, fever, fall, pain in the abdomen, infection of the nose and throat, cough, vomiting, and nausea. However, there are no significant safety risks and side effects for these 4 drugs, and again, they're all FDA approved.
Thank you, doctor, for telling me about all of this so that we can truly evaluate what is best for my son. I think that it would not hurt to get a genetic test just to see what specific mutation Bob has. If the mutation he has matches with one of these 4 therapies, I would be open to trying, and I'd find a way to save up for it, given how much more successful they are at preventing the progression of DMD than any other therapy out there.
Yes, I'm open to getting a genetic test and trying an exon skipping therapy, especially if that means I can continue to walk a little longer.
Hi Bob, pleasure to see you again. As important as physical therapy and fitness is, mental health is just as vital in ensuring positive health and well-being. An additional recommendation I have for you as a family is to participate in family therapy or enroll in a DMD support group, if you'd like. I can refer you to specialists that can provide you with individualized education program, an IEP, through which you have the option to begin homeschooling. This journey can often feel overwhelming and alone, but having friends in the DMD community can hopefully alleviate this stress and answer questions and overall be beneficial for you as you find peers like yourself and avoid isolation.
I think it would make me feel better to find people my age with my diagnosis. I would love to be part of a support group, Dr. Sengupta. My mobility is decreasing and going to school and social interactions just aren't the same. Being homeschooled might be the best option. I could still see my friends outside of school. I love gaming with them.
Thank you so much, doctor. All this information about treatment was very useful for us to begin tackling DMD. However, we're not as fortunate as many others financially. We're middle class and we just can't afford a lot of this. I want my son to have the best treatments available at his disposal, but this disease is financially draining for us. The initial diagnosis, the gene therapy, steroid treatments, trying to get expensive assistive devices like wheelchairs and ventilators, and needing specialists for physiotherapy and psychotherapy is just too much for us. I'm lost as what to do next.
Please do not stress. I completely understand where you're coming from, and I'm here to support you through every part of the way. Let me provide you with this resource guide, where several nonprofit organizations help families through the DMD diagnosis and disease progression. One nonprofit organization that can help cover the costs of your specific exon skipping therapy, AMONDIS 45, is the Assistance Fund, which provides financial assistance to families like yours who face high medical out-of-pocket costs. Given that AMONDIS 45 alone would cost over $748,000 per year, I would highly recommend that you take advantage of the Duchenne Muscular Dystrophy Financial Assistance Program under the Assistance Fund. This program is currently open and accepting new patients. It covers AMONDIS 45 and even the other 3 FDA-approved exon skipping therapies. Requirements include U.S. citizenship or permanent residency, some coverage by insurance of the treatment, and that the financial eligibility criteria are met by household income and size. If you meet these requirements, the program can be very beneficial to you and your family. Another nonprofit organization that can alleviate the costs of the assistive equipment like the wheelchair and ambulation devices, and also the clinical care treatment you may have been denied due to the affordability, is the Little Hercules Foundation and Team Joseph Collaborative Duchenne Family Assistance Program. The last organization I recommend is the JET Foundation, which is a nonprofit organization dedicated to improving the lives of individuals and families affected by DMD. In addition to research and awareness, the JET Foundation offers a wide range of support programs and resources to empower individuals with DMD and their families. They provide assistance in navigating the complexities of managing the disease, including access to medical professionals, care coordination, and guidance on available treatment options. The foundation also organizes support groups, camps, and retreats, providing opportunities for families to connect, share experiences, and find strength in a supportive community. Let me leave you with this resource guide with 3 organizations I mentioned and many more that are at your disposal.